How can complex seizure terminology be made clear? Imagine trying to understand a language full of complicated words and phrases. That's what it can feel like when trying to grasp seizure terminology. But with a few simple steps, we can make it much easier to understand. First, it helps to know that seizures are mainly divided into two big groups. One group is called focal seizures, which start in just one part of the brain. These can affect how someone feels, moves, or behaves. Sometimes they stay in one spot, but other times they spread across the brain, causing more widespread effects. The second group is called generalized seizures. These begin on both sides of the brain at the same time and often cause a person to lose awareness or consciousness during the event. To make things clearer, it's useful to understand how doctors classify seizures. They look at 3 levels. The first is the seizure type, which describes how and where the seizure starts. The second is the epilepsy type, which groups seizures into categories like focal, generalized, or sometimes a mix of both. The third is the epilepsy syndrome, which is a more detailed diagnosis that considers other features like age of onset and seizure patterns. Breaking down these terms into simple language makes a big difference. For example, instead of saying focal seizure, you can say a seizure that starts in one part of the brain. Visual aids, like diagrams showing how seizures begin and spread, can also help. Imagine a picture of the brain with arrows pointing to where seizures start. This makes the idea of focal versus generalized seizures much easier to see and understand. Using real-life examples can also help. Think of a person who has a seizure that affects their hand or causes them to see flashing lights. That's a focal seizure. Or someone who suddenly collapses and jerks all over. That's a generalized seizure. These stories make the concepts more relatable. It's important to avoid overly technical words unless necessary. Instead, focus on what these terms mean for the person experiencing them. For those wanting to learn more, trusted sources like the International League Against Epilepsy or the Epilepsy Foundation offer clear, detailed information. Understanding seizure types helps doctors choose the right treatment and helps patients manage their condition better. Explaining these terms clearly can also reduce stigma and promote understanding in the community. When everyone understands what's happening, it's easier to support and help each other. By using simple language, visual tools, and real-life examples, we can turn complex seizure terminology into something accessible and easy to grasp. This way, more people can understand epilepsy better, feel empowered, and know when to seek medical help. Remember, always consult healthcare professionals for personalized advice, as each person's experience with epilepsy can be different.